earlier days we used to do open surgery, kind of transformation which we saw from an open surgery to minimally invasive, the way the patient recovers so quickly as opposed to open surgery where the recovery was very slow, chances of infection high.
Today we have a guest, Dr. S.N. Manohar, who is the early adapters of MR-guided Focused Ultrasounds. So we are going to talk to doctor that these kind of technology, when patient or a doctor adapt, how this going to change their life or outcomes. Welcome to Medical Marvel Podcast.
Thank you for the privilege. I'm Dr. Manohar.
When these kind of technology or early adapter, if you adapt these kind of early technology, what will impact for your career and for the patient context also?
Thank you very much. I'm Dr. Manohar, the President, Medical and International Affairs. A small change is all that I am an adapter. It's not me, my chairman, a visionary, Dr. Madheswaran, and the first master surgeon, neurosurgeon. When he went for a conference in 2022, he saw this and he was the first man to bring it here when all big hospitals, doins were there. He was brave enough to bring a huge technology first time in India.
Right.
See, this one, as I rightly told, you asked a right question that is technology, how are you going to match the technology and the patients, this thing. Technology is very important.
Right.
And it's most important to convince the patient also. It has been a golden standard. Surgery has been a golden standard in treating Parkinson's before. Now, it's a knifeless surgery. Within 2 months, no anesthesia, no nothing. Patient is alive, patient is speaking. We are a part of the team. And after 2.5 hours, he's almost fine. Much better. It's like a magic.
Right.
No one will believe you unless they see this. You have to see patients before and after. You would have seen our videos there.
Right.
How the face itself is glowing. So these type of technologies are there, as Dr. N.Senthil, our team lead on the MRG and chief consultant radiologist has clearly put in the slide, has been from long time. But recently, after a lot of researchers, the FDA and the CDSCO has approved for the treatment of Parkinson's essential disease. To add more, I will give to Mr. Sundaraj on the technical side of the MRgFUS.
I would love to know that what will be the doctors different, who is right now adapting the technology and who is not adapting this technology. What will be their practice would look like different after 5 or 10 years?
Well, it's a kind of difference. Thanks for asking this question. Let me introduce myself.
Yeah.
I'm Srinivas, Vice President at Royalcare Hospital, primarily focused on promoting MR-guided Focused Ultrasound. Now, this device, introduction of this device will bring about a change to the extent wherein earlier days we used to do open surgery, whereas subsequently when laparoscopic came in, minimally invasive surgery, the kind of transformation which we saw from an open surgery to minimally invasive, the way the patient recovers so quickly as opposed to open surgery where the recovery was very slow, chances of infection high. This is the level of transformation which you will get to see as the new incision-less procedure becomes more and more popular. Currently, the procedure is clinically approved by US FDA as well as CDSCO for treatment of essential tremor and complete Parkinson. When we say complete Parkinson, not only tremor-dominant Parkinson, but rigidity-dominant Parkinson, dystonia, dyskinesia, everything. Every motor symptom of Parkinson gets treated here. I would also like to say that one needs to know that there is no curative solution for either of these neurodegenerative disorder so far. This is a symptomatic relief which we'll offer, just as most of the other procedures like deep brain stimulation and even the medication, and like so many other diseases for patients, someone suffering with diabetes or with BP, asthma, even cardiac. There is medical solution, yes, but then the medicine is not going to offer a curative solution.
Okay.
Likewise, here again, the procedure will offer a symptomatic relief.
Okay.
It's not a curative solution, but as a symptomatic relief, you are improving the quality of life for the patient as long as the patient survives. And that's the important part of it. We don't have any upper age limit for treatment. We do have a lower age limit for the treatment. I would request my colleague, Dr. N.Senthil, to throw more light about the application clinical aspect of the procedure. Thanks.
Mr. N.Senthil, welcome.
Good morning, Ramesh ji.
Hi.
Thank you for the
Welcome to
opportunity.
podcast, and I love that you are working as a team and
Yes,
you are bringing
we are a team.
better outcome and a positive outcome for the society.
Yes, definitely, because it's a teamwork. Because most of the patients with Parkinson's or essential tremors first comes to the neurologist or a neurosurgeon who
Right.
sees it first, and then they evaluate whether this patient can be uh, subjected to this MRgFUS procedure. So it's actually two technologies combined together.
Explain like doctors can easily understand
Okay.
who's working in a village or a
Okay.
last part of the India. And so if you explain that way, so he can also understand and he can guide if any kind of patient comes to them.
So in our
So
experience,
simpler language.
yeah. So in our experience in the Indian context, we see 20% of the movement disorders are from essential tremors, what we have treated so far in the last 4 years, and 80% of the patients were Parkinson's disease, who had got ACA12 and then dystonic components also. So most of the patients might be visiting the general physician or a neurologist who will be treating these Parkinson's disease patients. So our major cluster is Parkinson's disease. So people are well aware of the Parkinson's disease, and there are Parkinson's help groups are there in India also. Facebooks everywhere there is groups. So people are well known about this, but not much know about these kind of newer procedures, which is a better treatment option. So worldwide, it has been a phenomenal success. 25,000 procedures has been done.
Okay, great.
And it is very non-invasive. There is no to open the skull, and there is no anesthesia, no implant, nothing. The patient walks in, 2.5 hours procedure. The patient walks away without tremors, without rigidity, without bradykinesia.
So if I I would love to know or one or two word, this procedure for Parkinson's, mainly for a Parkinson's patient, right?
Yeah,
and who
in
else?
India we have Parkinson's.
Who else?
Essential tremor patients we will be able to treat, and the newer approval is for obsessive compulsive disorder.
Okay.
That is for even chronic depression patients also we will be able to treat non-invasively with this MR-guided focused ultrasound.
Okay, so great. So how outcome is better compared to if they are doing the procedures, and what will be the patient life different who is undergoing these kind of
See,
procedures?
most of the Parkinson's disease, if you see, there will be in need of either his own family or a support staff to do his day-to-day activities. They cannot do on their own. They cannot brush, they cannot eat with their hands, and they cannot write. But immediately after the procedure, the patient will be able to do his own activities.
Okay, good, great. I would love to ask one more questions. Let's take a two practical scenario. One doctors who's adapting to these kind of technology, who's treating to his patient. One doctor who is not adapting, he's resisting to technology. No, I will do my way. I'll figure out what I'm doing. What will be a different futures after 10 years? Like one kind of predictions I am looking in long perspective view. Why? Because when I visit more than 5,000 doctors I have interacted, I find out that doctor is resisting to technology. It's they, even though they'll adapt, but initially they have a resistance. So let's give a clear crystals that what will happen and
That's a good question. Early adapters are the technology. What now the AA has come into picture. So whoever is not adapting to the newer technologies, they are left behind. It's as simple as that. The older generation, they are still waiting, or the neurosurgeons who are still resisting to adapt it. But the current generation, they are adapting to the newer technologies, and it is good for the patient actually. See, as you know, the Parkinson's disease is a progressive neurodegenerative disorder. It will get worse day by day unless you treat them at the earliest. And we have certain guidelines when to start the treatment. If they are on drugs and if it is really helping them out, we just wait for some more time also, 2 to 3 years. And once the supportive drugs are not helping them, then we adapt into this new technology.
So great. My question is unclear. So yet, sir.
You asked a question, very valid question there.
So you are a more experienced and young generation.
You asked a question, a doctor treating now and the doctor not treating are not convinced.
Right.
Now the patients are more educated.
I do agree. And
You
but
know,
sometimes
the media, multimedia and the Google doctor plays a major role.
Right.
If you type now what is the best treatment for a Parkinson disease, first thing will come as MRgFUS.
Right.
Rather than the DBS. See, so if the doctor is saying DBS there, he will ask next question, why not MRgFUS? The doctor should be giving him a valid reason why he should go for it.
Good.
As he rightly said, not all patients will go to DBS, not all patients will go to MRgFUS.
Right.
There are prerequisites. When all these conditions fail, they'll go. But majority we have seen DBS is an invasive procedure. The patient's electrodes are put in the brain. It's like a pacemaker. He has to be calibrated. It is running on a battery.
Mm-hmm.
Whenever there is some problem, stimulus, it holds it. But this is not like that. It is a permanent lesion. Nothing to worry. He can free to travel. Here he has to go to the hospital. He has to be near the hospital. He has to get a calibration. So on and so forth. And displacement of electrodes is one of the major things. If it's displaced, again he has to go for a surgery. All this, if the doctors don't, even if they are top doctors, if they don't follow, the practices will come down because modern technology has to be embraced.
Right.
AI is coming in. If you don't embrace that, you are left behind.
Good.
You will practice.
Right.
I'm
You
not
will practice,
telling
but
that
you will struggle.
But patients will come.
Patient count will down.
People are more informed than the doctors. You mean to say we have treated 250 patients? They're doing much research. They come here. They do a lot of research. They talk to patient. They ask first question: can I talk to the patient you have treated?
Wow. So they want reference also.
Exactly. We give them.
They want evidence.
With nothing else.
So this is a major change last 10 years, 1 decade, 2 decades.
22 is been approved by only 22 FDA is approved.
Okay.
Drug Association of America. See, that is the golden standard. When they approve, all the world says yes, we can do. So 22, then 22 we embrace this.
Good. So one last closing advice to young doctor who is starting their practice to get a success kind of you to be a name in India levels. What they what principle they have to follow? New doctors, yes. 1 or 2 principle he have to follow so he can get a career success.
I'll give you. You have to talk to people who have embraced this. Royalcare, being in the lowest part of the Indian city, was the first thing when doyens in India and Southeast Asia, even flushed with a lot of money and experience, have never put this. So you have to talk to them. There is nothing wrong in seeing. Initially, when CT scan, you are asked a question.
Right.
How do they embrace? How did they take an MRI system?
Right.
Why did they want MRI when CT scan was there?
So
they were forced to in. You don't have an MRI, people will not come.
Not will come. So you have to embrace the change, whatever the change is coming.
You have to, without any kind of a setback or without any kind of an ego, you should talk to people who have experience. Give them chance to, in the platform, to share their experience. We are not here to restrict this thing.
Right.
We are here to share our experience, hold hands. A typical example is we have tied up with Sir Gangaram Hospital.
Okay,
we have put our own mission in their center.
Wow.
And we are holding their hands and they are doing extremely well. So we are in collaboration with them. That is one of the...
So who have done, you should learn from them.
Yes.
Yeah, this is the best advice the young doctors can have. So they don't have to waste their life, energy, money, effort.
Yes.
Directly they can embrace their experience, wisdom.
Exactly. Gangaram was good enough, clever enough. The medical director and the group, the chairman of the group were very wise enough to have a tie-up with us, and we put our equipment there. And we are jointly working. And
Correct.
they are treating a lot of patients in
So
Delhi.
he don't have to do everything from scratch. You you are a support for them.
Exactly. And one more point, MRgFUS and medical tourism.
Hello, sir. Welcome, sir.
I'm Dr. Kishore. Well, basically, I'm a cardiac surgeon, but now I'm Vice President of International Marketing and International Affairs and Medical Tourism.
Good.
So
So you work on the medical tourism.
yeah, I'm taking care of medical tourism.
Medical affairs, medical tourism is a part of it.
So what India is missing to become a global
India
hub
is not
for-
missing. India is
Nothing?
evolving.
Okay.
India
So-
is evolving.
Evolving.
India has become the center now for medical tourism.
Great.
People from all around the world are trying to come into India for treatment because it's affordable. It's quality wise. Quality wise, there is good quality, and the Southeast Asian countries are going in turmoil now. So that has facilitated our patients' input so that more and more medical tourism patients are coming in.
So if a doctor's or a hospital it is there, he want to attract the patient from abroad, what fundamental structures wise or a fundamental change he have to do in his practice?
Number one, infrastructure. Number two, their cuisine.
Number two?
Cuisine.
Okay.
Food. Number three, you have to take care of the travel and other
Okay.
formalities. It's flight to flight service.
Okay.
In the sense, if they get down from the flight, from then onwards until they get on back into the flight, it's our responsibility. The more and more courteous you are, the more and more careful you are, the more and more loving you are, people will be coming in. We have a platform. We have a platform, and in that platform, we get patients.
Can you name it so my audience can love to reach out to the platform?
Yeah,
and
we have tied up with the Global Health as Accreditation.
Okay.
It's a world-known platform which puts you on the world map, and then you are able to get patients from there.
Great.
And Dr. Manohar will be able to.
I will add a few things to more. You want to know, see, people abroad are waiting for treatment for a simple surgeries.
Okay, great.
It is not that they don't have facilities. They don't have doctors and time for them all to be operated. But India is a vast country. We have wonderful doctors.
Right.
No waiting time is one of the most important things. Number two is the cost.
Cost.
We are 1/3 or 1/4 of what they are going to pay there, the insurance. 1/10.
One time.
So
Let's give me one example. Okay, so if surgery.
simple question, an angiogram will take.
Okay.
Angiogram will cost about $10,000 to $15,000.
Okay.
$10,000 to $15,000 is how much you can calculate.
Brilliant.
Our angiogram is how much, doctor?
How much?
25,000.
Only 25.
Not even $1,000.
Not $1,000. Right. So it's used. In one NGO, they can come and go and complete their treatment.
That's exactly.
And even then also, it will some they can save.
They need not wait. And the main thing is, whatever the technology has been introduced in US, the next moment it is in India.
Wow.
See, 22 FDA approved it. 22 August we are operating.
Wow.
See, one more thing is, if you see I'll give you a music card. There are a lot of medals like them. I'm not a military man.
Otherwise, you could have had it.
That medals are not just for the sake of it.
Right.
It shows our commitment to patient-centered quality and safety. That is what they want. That is what their hospital has. See, if your hospital has the same kind of delivery, you can deliver the same kind of a safe care to them, they will be prepared to.
Right.
That is a major factor. No waiting time, personalized care, 1/10 of the charge. Would you not go?
I'll go. Why not? I'll go. So how, what kind of percentage, if you have met many doctors across in India or abroad also, what number of percent you will believe the doctors who's evolving and changing and what percent is not? Just
see, it is not the question of doctors now. See, we are evolving into a kind of a corporate hospitals have come in. Corporate and bigger hospitals have come in. See, the doctors are only facilitators to this.
Okay.
The hospitals have to take a business. See, it is about, the whole market of India is about 80 to 100,000 crores per year is the medical tourism.
Right.
Right now it's happening. So,
just to add to what Dr. Manohar just now mentioned, you see, say any item that you buy, for example, we are drinking Bisleri.
Right.
Right? What do you look for any packaged water bottle? First thing, what do you look for?
It is a pure satisfaction. I should believe in this.
How do you know it is pure?
The image perceptions, whatever said during the so many years or what around everyone is telling.
The company which is making it.
No,
one is the company that is making
right.
it. Secondly, who is certifying that the water is pure? It could be water out of the gutter as well, right?
We don't know, right?
So, therefore, you look for ISI mark.
Right.
Correct. Like same way, even in medical fraternity for hospital, every patient from abroad will look for accreditation.
Okay.
That is
so, who is certifying your hospital? There are international organizations which are accredited.
Okay.
They recognize for the quality of care, for the quality of patient care which you are giving, for the systems which you follow within the hospital, for the treatment protocol which you follow. Each and every aspect of medical treatment is certified, accredited by a third party international organization.
Okay.
These are not self-proclaimed. This is the difference. So
They are all
any
number
patient today,
That is number one.
Right.
They are all number one.
as a result of availability of information, Google, as Manohar and N.Senthil were talking about, it has become very easily accessible. Patients know which hospital is certified, accredited, which hospital is not. So that is one simple benchmark available for any patient to recognize that yes, if I am treated in so and so hospital, which is accredited by half a dozen worldwide recognized institution, there is a good quality. Just
Right.
as we are picking up Bisleri
Right.
out of so many water bottles. Why? Because of the ISI.
ISI.
It's the same way.
Right.
Yeah. So
And Rameshji, coming back to your question regarding the doctors, as you look at the latest data, 125,000 undergraduate doctors are coming out
Every
fresh
year.
from every
Every
year,
year.
and 65,000
Almost 14
postgraduate
lakhs
doctors
is already
65. So to become the clinical acumen is the best thing.
okay.
So they have the younger doctors, they have to create their own clinical acumen, they have to be strong in their clinical fields, then only they can approach in a better way. So it is a big survival thing.
So clinical is not coming like it's a kind of foundations. Rest
Right.
they have to do many things beyond foundations.
Yes, it takes time. See, for him to evolve into this stature or for him to evolve into this stature, he has put years and years of practice. He worked in Puttaparthi. He does free of heart surgeries
Oh,
for
great, sir.
thousands of patients. Every year he goes there and then does that. So that's all improving his clinical skills and everything. So the current generation, they want everything immediately. That will not happen. That will
Immediate
not
success.
happen. Immediate
So
success, that won't
the
happen.
kind of success you have placed almost 25, 30 years, then you are on this stage. So what is the mindset behind this immediate success? No, hard work.
People are passive.
No, the kind of right now mentality as or we can say mindset as N.Senthil has said. So why this mindset
Why this
for younger generation of
The
doctors?
new generation is like that. They have everything in their hands.
Okay.
We were looking at, when we were studying, we used to go to the library, look for references and everything. There was not that
Okay.
much time. Now you see, you just type of a word, you get everything. Gemini, everything is there on their hands.
You asked a question.
Yeah.
You asked a question. You asked a question. How to do this?
Right.
You have to keep your mind, whoever it is. He may be a young man, young doctor. He may be an old doctor, experienced. You have to keep your mind open to what's happening in the world.
Right.
You should start embracing what's happening in the world. Correct?
Great.
It has to, you have to embrace the system. You cannot say, I have learned everything, I know this is the best. There is nothing called best. There is always that nothing is best. It's always better.
There is
better,
always
better going
chance to improvement.
Exactly.
There is always chance to
Exactly. That is how we have our science.
learning. So there will be a difference between the doctor who is learning and who is not learning
Exactly.
in the future.
See, you want that platform. Today is the platform.
Right.
Like this, if many associations, now it is an AMRAB association. If Gujarat Medical Association annual calls us, we will give us.
Right.
So then more doctors will get exposed. If Maharashtra calls, we will go and do it.
Right.
It is not that, it's not to undermine anyone. It is to share our knowledge so that benefit is ultimately who has to benefit?
Patient and doctor itself, his career also will get benefited.
Similarly, for a medical tourism on an MRgFUS perspective, I'll tell you, you can talk. You
So,
can say that
as
you can
aquat-
come here. People are waiting for MRgFUS.
Every day is a learning curve. Once you stop learning, you stop living.
Right.
MRgFUS, though many centers have started to come up, but still we are leading. Number one, because of the quality, the results, and then affordability. And we are always having a welcome attitude. That is what is most important.
Thank you.
Compassion.
Right.
How medical tourism and MRG works together.
So thank you very much for sharing this knowledge. I am sure and I hope this help to young doctors in a lot of way to save their career
Not only
and to be established and young doctors also. So my motto is to create a platform where you kind of senior who experience life, technology, everything they can share their wisdom, though, to whom you can don't reach directly. So this is a
without hurting their egos.
Good.
Respects, pronouns to all their experiences. We would like to share humbly our experience.
sir. Thank you.
Opportunity to welcome you to Coimbatore.
I'm sure 100% as I
Hospitality.
and I'm sure 100% whenever my visits, I'll reach out to you. I would tell to take your details and we'll reach out to you. Okay?
Now you shouldn't say Isha.
Yeah.
You should say Royal.
Royal, sure.
Royal Isha.
Sure. Thank you.